I am Divya. I'm from Rohtak, Haryana. It's about 60 kilometers from Delhi border. I did my MBBS. I'm batch 2015 from VMMC and Safdarjung Hospital in New Delhi. And thing that I want to talk about today is my journey as a travel fellow. I spent a year traveling, let's say 5 to 6 states overall, and stayed in 3 different states over a period of 1 year. I was in Rajasthan in basic health services for about 5.5 months. Then I went from there to South in Tamil Nadu. And from there, I went to Bilaspur in Chhattisgarh. So why I chose to travel was I was very confused even during my MBBS. I didn't want to do my PG at all. I was not sure if uh, PG or medicine was right path for me. And was sort of a rebellion as well against my parents. And then there was always an inquisitiveness to know more, see more, because in living in Delhi and in Haryana, which is like a very uh, like rich state economic wise, you don't see a lot of poverty, the stark poverty that I actually saw in a period of next 1 year. And also because I could take a year off, I was privileged enough and to say that, I'm going to take a year off, explore and see what happens. So the journey, my journey started from Rajasthan. It was quite eye-opening for me. Um, working in a tertiary care hospital as huge as Safdarjung, you don't really see a lot of people behind the diseases. The people become cases, and you don't go beyond that. But um, Rajasthan is based in BHS. You have a primary healthcare setup, so like it's like being a part of a community that I experienced. Like in this photograph, we 3 people belong to very different backgrounds, very different caste statuses, very different places, but we still became friends. And this is one of our trips that we took together. So I also learned that there's a limit to what we can do as doctors. For example, uh, if there's a TB patient, you are obviously going to counsel him, you have to eat, you have to take some amount of fat, protein. But in cases like you see in Rajasthan, with like there's the BMI would never go beyond 16, 17 in normal people. So a TB patient, I've seen TB patients with 12, 13. There was a woman who came with 12.5 and like she's not getting pregnant. So I mean that was normal. So and even if you give them food, it's going to be distributed among 5 different family members. So it's hard that you like this is like, and if you are going to give him treatment, it's not going to cure the disease unless there's weight gain, there's nutrition level is proper. So in Rajasthan, there was also other things that I was involved with was a lot to do with the migrant workers and their rights, legal rights, educational rights. So through that, I saw a bigger picture of health, and then that health was not really limited to just hospitals and curative medicine. It was much, much more than that. Then after my rich experience in Rajasthan, I went to Tamil Nadu. It was sort of a challenging thing to do for a North Indian who did not understand Tamil at all, no exposure. But it was quite a different experience. It got me a lot thinking because I could not understand, so verbal communication came into picture. The healthcare system there was very, very different from you see in North. The Anganwadis were better functioning, the hospitals were better functioning, but there was still need. There, I went to JSS. The major issues which I thought were there were the broken systems. It was similar as I saw in Rajasthan, but one of the major issues that was very different from other 2 centers I've been to was the access to healthcare centers. The catchment area of the hospital uh, of JSS is in a core area of a tiger reserve, where there's a river who cuts the villages. So for the 4 months of the monsoon, it's very difficult to access any healthcare facilities, especially in the cases of snake bites. which is a which is a public health problem in India. Um, so I so why Vasu said that I had a different journey, because practicing as a doctor for years, seeing the rural primary health care and medicine, I chose to actually prepare for UPSC CSE. It was partly because I was always interested in governance and how the governments worked, and seeing all the non-governmental organizations that were doing some great work. I realized that to make a sustained change, you have to work with the systems, and I did not understand anything about the systems at all. And so I thought that, it's a good idea to like there's also an interest, and there's also like there's something that I could do at a policy level to make some amount of change. So that is why I decided I'll go for it, and I'm actually studying for it now. So the challenges that I see for this exam is that it's said to be the toughest exam. There's bureaucracy and the bureaucratic challenges, and you might have some idea, but you don't actually have an idea unless you're actually into it. Also, there are certain advantages of having an MBBS degree, of having some experience as an MBBS doctor. That there's always going to be it is always going to be something to fall back on. There's always going to be a need for doctors, and I frankly enjoyed being a doctor. And so it's not like wouldn't have an employment even if I failed to clear the exam. And then it's sort of a privilege to be an MBBS doctor and say, you know what, like, yeah, I mean, I can go for it without thinking, what will happen to my family? How will I survive if I don't clear this exam? And also, like, a lot of things that I gained through 5.5 years in medical college and the travel fellowship, I actually can apply to at a policy level, actually can see the change. Or maybe not, like, we'll see. Thank you.
Divya, can you tell what this being a travel fellow is? Because not many people would know that. I think majority wouldn't know.
Okay, so travel fellowship, it started in, if any of you have heard about Tribal Health Initiative Siklingi. So I think it was proposed, it started from there. They have a rural sensitization program, and through they branched out to give young medical graduates or postgraduates in at any step in their journey as a doctor to explore if they're confused. Like, I think that's the first criteria too. And I think all of you must be confused if you're here listening to us talking about the alternatives to PG. So if you're confused, you can actually travel for a year. There are about 12 centers, I think, now. You can go there for a few months, explore, like work as a physician, or like there are some non-medical centers as well, and then explore. Like, you have the freedom to explore what's there other than healthcare. Like, if you are interested in organic farming, you can go to a place where there's organic farming. Basically, it's to actually have you give like young medical doctors to think about what is actually happening in that. Um, so yeah, I think this is the third year there. This is the third year of the travel fellowship. There's a brochure that I can share, I think.
Yeah, we can go for that later. I just wanted the clarity on travel fellow since you mentioned it in the first slide itself. So we'll take the specific Q&As at the end and sharings about travel fellowship and rural hospital network and all that. So we'll quickly have all not quickly, well, 12 minutes for each, have the speakers, and then we'll have the Q&A session. Yeah, so our next speaker is Arvind. Is it Pradeepa or Ramya?
Pradeepa.
All right. So Pradeepa is did her MBBS in the south in Tamil Nadu, and if I'm correct, and then she has again ventured to a very different setting in Rajasthan and very challenging setting also, and we'll hear from her directly. But she's doing great work there. All right, Pradeepa, over to you.
Yeah, just a request to the presenters, if possible, please turn on the video.
Hi, Arvind and Abhiram. Thank you, Vasu. So I just share my. Hi, so I'm Pradeepa. I'm from Tamil Nadu. I finished my MBBS from Bangalore in last year in February 2021. After that, in February of 2022, that is next year, I joined Basic Healthcare Services in Rajasthan. I work here as a medical officer. This is the center where I work in. This is basically a primary health center. It is run by on PPP mode by the NGO Basic Healthcare Services. So we cater to a population of 25,000, and it's a delivery point and also a first referral unit. So if I want to talk about my journey, like everybody, even I had started preparing for PG, and that's why there was a gap of 1 year before I joined, before I came to Rajasthan. So, but then I realized that this was something I didn't want to do. It was just like the idea of PG just came because everybody else was doing it, and I really didn't realize why I'm doing it or what I should do. And then I also realized during my internship that we talk about technology and so many investigations and new surgeries and all of that. But if I see the from the patient side, it's just more confusion and they are just anxious and worried and not satisfied. So I wondered where the medical system is going and like what is the future for doctors or for medicine. And then that was one reason I wanted to see more. And then one more thing was that I during my internship, I realized that every specialty just wanted their PGs to learn and not the interns. So I didn't want to be one person who just wanted to see a subtype of patient and then refer the patient that I didn't know to another doctor. That didn't make any sense to me. One more thing was that I had attended a rural health camp during my internship days, and that experience was so satisfying. It was the first time I felt like a doctor during all of my internship days, and I wanted to see that path more. So I came to Rajasthan, and I chose Rajasthan because I was in South all my life. So I wanted to go somewhere else, go completely out of my comfort zone, and uh, to a new language, new culture. So that's why I came to Rajasthan. And so learnings during my journey has been that one is that I first thought primary healthcare is just treating simple diseases. But once I came here, I realized that it's not just that. It's so much more because the people don't come as certain cases that we read in the book. They just come with their symptoms and their problems. And it is for the doctor to see what it is and to think more and do two things. So I realized that it is not just a simple thing that we think of. And another thing I realized is that uh, if we can provide a good quality care, the health system would be so much more, and there won't be so much burden on the tertiary hospitals and the private hospitals, and all of those problems wouldn't exist if the primary care is strengthened. And I realized that for that we need trainings and we need referral system, we need the support of the government and all of that. So that was also one thing that I learned. So just to give an idea of what we see in our clinics, so we see from pediatric cases, we see dermatological conditions like psoriasis. We see severe acute malnutrition. There are infected wounds like this, maggot infestations. This is the X-ray of a very severe TB. So you, in a typical day, you see all kinds of patients, and you are that doctor for them. You are the only doctor for them. So again, just to give an idea, so I see 80 OPD patients every day. We have 30 patients on TB. We manage diabetes and hypertension patients. And you can see, so from this you can see it's not just simple things, it's so much versatile. You know, COPD, asthma, and all of these. Severe anemia, we see patients with 4 gram hemoglobin roaming around, and all of this, and there are road traffic accidents, medical emergencies, and all of this, you serve as the first responder in all this. We also see conduct 40 deliveries per month and manage all emergencies of PPH, PH, all of that. Also, I realized that the doctors in a primary health center or in a rural setup, they have to be so much more knowledgeable, and they have to be so much better in critical thinking, because they have they have to think about how long it takes for a patient to go to a bigger center. They have to think of affordability. They have to think of acceptance of the treatment. And so all of these things really enrich you as a doctor, as a good clinician. So my learnings has been that one is that, to make diagnosis by relying on history and clinical examination, because we don't have the opportunity to do all of the lab investigation. So that is one learning. And also give importance to the patients. You don't just see them as cases, you also see them as a human being. You listen to them, you let them talk, you listen, and you try to somehow be a part of their life, and give them hope and all of that. So I learned communication skills, and then you manage a team of people. You manage the nurses, you manage the healthcare workers. And so I also learned to be a team player, to have the leadership skills to manage like that. And as I said earlier, you have to have that critical thinking to when to take a decision, how to do it. Uh, you know, uh, to manage a patient here or to refer them somewhere else. All of this requires a lot of things that we never learned in MBBS. I learned only after coming here. Then one more important thing was that it is the treatment of a patient goes beyond prescription. Just writing a medicine will not cure them, because there's so much things like poverty, like malnutrition, levels of education. All of that influence their response to accepting your treatment, to following it, and it also has an influence on the disease. So that was a very important learning. And then I also realized that it is a great privilege to be a doctor. We don't realize it when we do MBBS, because we just see super specialists and specialists, actually taking care of patients. But here it's hardly there's one doctor or the 2-3 doctors in a population of 25,000. So you are the first person that they come to. So if you are good enough, and if you can have the compassion to talk to them and to be there for them, it is you will change their life. So that was something I learned. And the challenges, again, even after, there are so many good things, but there are always challenges. One is that sorry.
Please go ahead.
Yeah. So one is that there are things that you cannot change. You cannot change the poverty, the migration issues, literacy. You cannot change the public health system, some poor systems that are in place. You can't change any of that. So sometimes you get help. You feel helpless. You feel desperate because you can't do anything about all that. Then it does get lonely here because you might not have the peer group. Like people here could be different, and all of that could have a toll. And it's also a huge work, because you are in charge of 6 villages, and if you start thinking of what all you can do, then it just keeps enlarging, and you have to manage your sub centers. You have to see Anganwadis are doing their work and all of that. If you take an interest, then it is a lot of things that you try to change and try to work on, and that could be overwhelming for some people. Then one more unique thing in the PPP mode is that you are working with the government and with the NGO. So sometimes the government can pressure you like for their targets and vaccinations and all of that. So you need to see how you can handle that. There will also be political influence. There'll be the village heads who will come and tell you to treat people in a certain way. There'll be issues of caste and all of that. So that also you have to handle as you go. I think just as a last message, I would just say that there's no time to do things. There's no like you have to do PG by 28 years, you have to do DM by 30 years and like that. So you just have to take your time. And I see all the doctors here, my senior doctors, 50-year-olds, 60-year-olds, still learning and still having that enthusiasm. So there's no time limit like that. So just take your time, understand yourself, and see what you can do. And also one more thing is that don't I was regretting, taking up MBBS, but once you come outside and see the need for doctors, and you understand that it's a privilege. And if you have got here, you're already achieved so much. So don't be hard on yourself. Thank you.
Super. Thanks, Pradeepa. Both Pradeepa and Divya have brought out some very important points which we forget. That don't be hard on yourself and be open to exploring. The other thing they have both said is the learnings outside your or our current education system happens in such places. So don't lose that opportunity and jump to thinking that PG is the only thing where you learn. In fact, if one spends time after MBBS in different places with eyes and ears open, there's much more to learn than what one would, by jumping into the PG rat race. So thanks, Pradeepa and Divya, and we'll move on to Ramya. I also wanted to tell you that which Pradeepa said, that one needs more doctors in primary care than as super specialists. Primary care physicians are themselves super specialists. And Pradeepa has shown that in a slide. It's very challenging. If challenge is something that drives people, then primary care physicians probably have a more challenging role to play. So, okay, sorry for taking up so much time. We'll move to Ramya next. Thank you.
Okay. Hi. Hi, am I audible? Okay.
Yes.
Okay. Okay, can I share my screen? Okay. Thank you. Okay. Okay, coming back there. Okay. So, hi everybody. Good evening. And first of all, I would like to thank DoctorNet for giving me this opportunity to talk, and Vasu actually for suggesting me or asking me to talk here. Okay, so my journey, I'll just talk how it was. So this is from my little book of happy things. That's what I name my things usually. So a little bit background about me. I'm from Bangalore and I studied in Bishop Cotton Girls School, Bangalore. And my MBBS I did from Enapoya Medical College. And currently I'm in Swasti Swaraj. It's in Kalahandi, Odisha. So how did I choose this path? So choosing this path, first of all, my college, Enapoya, already has a very early exposure to community health. They do a lot of community work. They're involved in community programs. So there itself, I had some exposure. And the professors I work with, they are into community health. And then I was also thinking about options other than the mainstream one, because I had this one, like I also, I remember this. So when I was in this one internship, so my friend and I wrote the UPSC Combined Medical Service exam just because we both can go and attend the interview in Delhi together. And that was the main reason, but somehow we got selected. But problem was interviews of both of us were at different dates. And then I went and I got selected in that also. And but the other friend didn't get selected. But then she started preparing for PG. But I have to go here. So I was very worried. Like everybody is doing PG and I have to go do this. So I remember telling everybody I'm not going to do that because I want to do PG and I've not yet gone there also. And so then afterwards I started listening to people from other organizations. And when I was in college, the Doctors Without Borders, MSF people had come and they had spoken. So I was also interested in the NGO work from them also. That was a very young age. Like I remember sitting with the pamphlet and thinking that okay, the work they've done was very interesting, I should be here someday. And then also while reading and all, I realized there was a lot of inequalities in healthcare, which it's like the rich gets richer. So it's always the richer cities and states have better health facilities than the poor ones. And it is very sad once we start entering the rural areas, we realize this. My short journey. So first, I told you after this thing, I was work. Okay, all these pictures are mine. So if you see this place, this is taken in Kalahandi. So it is like the road not taken for me. It reminds the road not taken by Robert Frost. And then this first few months, I was working in this corporate hospital. And after some time, the COVID came and it became a COVID hospital. And then at the same, I was getting very frustrated because the work was becoming very, it was the same. Like you come, you do the same work. I was more interested in field work, but that is not there when we are working in corporate hospitals. And then I got this opportunity from MSF, Doctors Without Borders. So then I applied immediately, and I remember I went because it was an emergency project. In 4 days, I went to Manipur. And there is when I noticed the difference between poor this one setting and corporate setting. So in the corporate setting for COVID, we were using remdesivir left, right, center, and antibiotics can go Piptaz, linezolid, it can go up and up. But here, max antibiotic we were using was ceftriaxone and X-rays. So in the corporate hospital, we were just doing CTs for all patients to diagnose COVID. It is CT. But here we didn't even have the facility to do X-rays. Like only if we could not reach a diagnosis and the patient is deteriorating, then we went for X-rays. So it was like there you remember how important the clinical skills of doctors come into place. And then I remember after coming back from Manipur, I was at home for some time and I was thinking, I cannot go back to a corporate hospital because now I've seen the difference in the workings of corporate and NGOs. So now I wanted to work in NGO. That's when I saw a WhatsApp message that there is a place where there is acute need of doctors. And then this is Samiksha. Samiksha did MBBS along with me. So I remember messaging her. She was at that time preparing for PG. It was her time that 18 months they had prepared for PG. So it was really very tiring for all of them. They were getting very frustrated and more closer the NEET dates come, the more anxious they were becoming. It was putting a lot of pressure on their mental health also. And then I asked Samiksha, there is an NGO. This is the exact conversation we had. So Samiksha, NGO in Odisha run by women, do you want to join? She's like, okay, Ramya, send me the details. And after 5 minutes, she's like, ha, Ramya, let's go. And in 4 days, we decide we come to Odisha. And okay, again, they will ask parents, how did parents agree for this? So Samiksha and I are together. So they were like, okay, you have a company, you can go. But they were always scared to send to Odisha because Odisha and any for South Indians, always the north place is a little scary. I don't know how it is, but in my house it is usually like that. So they are usually scared to send north anywhere. So after this, they were like, no, you're not going alone. And then I got Samiksha, and both of us just fled there. And when we went there, this is Rakshika. So we met her. She was an India fellow. And when we went there, we realized that there was acute shortage of doctors, and they were struggling a lot for doctors to stay there. And Dr. Aquinas, she's almost 70 now, and she used to manage the OPD alone. And almost 150 patients managing alone was a huge thing. And when we went, Rakshika's only thing was we should stay back, we should continue there itself. And then she took us to cafes. This is the cafe she took us first day, so that we are because we are coming from city, we should not get overwhelmed by the rural life here. So she was just showing us places around. And then still in our head it is, oh, we should go back, PG is still waiting for us, we should do that. And then this is the time when PG counseling was next PG was getting postponed, and even the counseling was getting postponed. So we got few more months to stay there. And Amina joined us. She's another doctor. In few months she joined. And then this was the healthcare, the clinics where we worked in. One is in Kaniguma. So this is a little bigger clinic where almost now we have around 200 patients on 2 OPD days they come. And Kerpai, which is a comparatively smaller center. And then the Select, which is usually a health and nutrition center. And so Kaniguma is 55 kilometers from Bhavanipatna, which is our, the office where it is located, the town. And then Kerpai is 85 kilometers. And then Select is 100 kilometers. So traveling was a huge thing for us. But it was not very tiring because we worked in a sanctuary. We were going into the road was a sanctuary road. And then what we did here, OPDs and ANC under 5 camps, and then teaching programs for DCHP students. So here you can see 4 doctors. We were 4 that time. So that was me, and then Kalaidas. He was a travel fellow who had come that time, and then Samiksha and Amina. So this was our OPD day. And then we had varieties of cases. Tuberculosis, you can ask, what are the all forms of TB we have seen? Everything. And then malaria, the severe malaria, severest form of malaria, like HB dropping up to 3 or sometimes even below that, and patients coming with convulsions. And sometimes like you, it was very overwhelming first in the beginning because I have never seen a small baby. Like usually we tell that children below 6 months cannot have anemia because they are going to come from the mother's thing. So they usually babies are considered parasites. So they will take all the nutrition from the mother. But here, the babies I have seen came with 5 HB. Still, it is shocking. Still, I'm thinking, how is it possible that small 5-month baby, or I think that was a 3-month baby, 3-month baby having 5 HB was still shocking for me. And sickle cell anemia, again, complication. Sickle cell was a very theoretical concept for me. But I started seeing sickling patients. And leprosy, to be honest, I thought leprosy was eradicated. So when I went and told Dr. Aquinas when she diagnosed a leprosy patient, I was like, oh, leprosy is there. She told, where are you? I told, ma'am, I thought it is eradicated. She told that is how it is shown outside, but actually no, leprosy is still there. And then scrub typhus, leptospirosis, malnutrition is like if you're talking about anemia, that common malnutrition is. And then diarrheal diseases, ASM. And then again, gynae conditions we had. We used to have these regular ANC camps there, and then high-risk pregnancies and common skin infections, scabies. So scabies, initially in the first few months, I used to think that I will get scabies from them one day because it was so massive. And then surgical cases also we get. We have burns, and I'll show you the pictures. And some psychiatric cases also, and malnutrition and TB. So we had a TB patient. What could be the lowest BMI I have seen? So the lowest BMI was 9. So that was very shocking. So, and
Sorry to interrupt, Ramya. Can you wrap it up in 2 minutes? Is it possible?
uh, no, little more 2 minutes. Can I take? Okay.
Okay, 3. Right.
So this is again the pediatric cases, lightning injury. This is the filigree mark of the lightning. So this was like shocking for me. I was scared to go in the rain afterwards for some time. And then this was a scrotal tear injury. And then again, a lady carrying on a cot by the villagers. So that delivery, one lady was delivered in the this one house. She had a twin delivery. So one twin is delivered. After 3 hours, they reached our clinic and told that the other baby is not coming. Then the team went and bought her back, and that is the 2 twins which were born. And these are other home deliveries which were conducted. And this is down. If you see the picture where children are talking. So that was a play conducted by the school program to show hand hygiene and diarrhea spread. And then this other 2 pictures are students from Bhubaneswar and St. John's, and we had Pondicherry students also who had come for exposure. And this is okay. So if you ask only work, no. We had all these activities. You see here down, and also we had learning also. Down we have we had gone to CHB Bisham Katak. We met Dr. Johnny Omen there, and other places I had. Okay, this is the other trips we had gone. And then highlight. Okay, I want to tell about this. I had my first meteorite shower in this place. So I was very like that is the best time for me, like seeing a shooting star there. Advantages, disadvantages. I will tell this. So clinical exposure was too much for me. Like if PG is definitely required for fine tuning our skills, but here also we got an opportunity to see become like a family medicine. You see all cases here and a holistic approach towards patients. So there was a we went to a trek which was 6 kilometers above Kutrumali. After we came back, we were really tired and we were sleeping. We were so tired to see another patient. Then a patient came, and when we asked, "Where are you from?" he told Kutrumali. So then in our head, oh, we have climbed 6 kilometers. For a patient to come from there, we should actually treat him well. So even though it was just a common cold, we were like, we have to do something and not miss out anything. And then
Your last minute, sorry.
this is my different thing. Okay, I'll tell you the last picture, different travel. So because of the rains, we couldn't cross the place. And then our driver put a log and we had to cross. And it's his wife first who's crossing this. And okay, so this is the road not taken, but it was the best road for me because if not option 1, then there is option 2 and to infinity. I was thinking option A, B, C, but then it will end in 26 alphabets. So numbers will have infinity options. Thank you.
Thanks, Ramya. Sorry, I had to cut you short.
Okay, I usually talk a lot. Somebody should stop me in between.
I hope people have questions for you, but you have another plan as well, right? You still don't have the NEET PG plan. So do you want to tell what your next plan is?
Next plan is now I'm going again. I'm working with Doctors for You in MSF. I'm going with them to Pune, another project, HIV and TB.
Yeah.
So main is one day I will go and work in Africa or South Sudan or some other place in India also which requires such help. That's it. And all these pictures are mine, okay? All mine.
Okay, we are not going to plagiarize. And you people who are listening and clearly see that I don't think Ramya has any regret of not doing NEET PG or going that direction. and her pictures also showed that. And again, reiterating the third presentation, which is telling us how important it is to be good primary care physicians. So it doesn't matter if you do PG, but if you don't do your PG well too, one doesn't necessarily become a good super specialist even after you do PG. While being primary care physicians and all-rounded primary care physicians will make a huge difference. So now to change tracks, or to add that gender balance, I have my friend Varad. Are you joining from the UK, Varad?
Yes, yes.
All right.
Yeah, I'm actually just eating lunch.
Okay, and yeah, we can hear plates and spoons. So,
Yes.
okay, Varad goes next. Varad did
Okay, thank you. No, I
MBBS.
listened to.
Yeah,
So
all right.
thank you, Vasu ma'am. I met Vasu ma'am when I was working in, when I was there for a month at, I don't, at JSS Jan Sasthu Sayog in Bilaspur. I'm sorry, I don't have any slides, but it's like I don't think I'll need them basically. And so I think the three speakers, like, they were amazing. Like, whatever stories they've told, I can relate with all of those stories. It's just having a complicated case and no one, and no support. So you have to call your seniors from your college. Tell me the answer. We answer it. This is these are the complaints. Tell me what is the differential. Because let's be honest, we've not studied that hard during our medical studies, and so like we that seeing a sickle cell patient for the first time, all these like nerve-wracking experiences of feeling so scared because you're the one responsible, but you don't know how to do anything, and then learning through it and
Sorry,
understanding.
interrupt. Varad, two things. Uh, I
Yeah.
haven't told them about your journey, right? So,
Oh yeah, I'll just do that
and
after I
then,
finish
yeah, yeah.
my first statement.
The other thing is, maybe if you turn off the video, we'll have better voice quality.
Oh, you can't hear me.
We can, but it's
Volume is less. If you find a way to increase the volume, come closer.
yeah, and there is a disturbance from the back. There's disturbance from the background.
I don't know what's the problem here. Okay, let's try this. Am I audible now? Is this better? Hello?
Yeah,
Is this slightly better?
maybe yes.
I'll speak slow and I'll try to find like a different place. Hello?
Yeah, better.
Is this better?
Definitely. Yeah. At least for me, I hope it's the same for all others.
Yeah, the background noise is reduced, but
Yeah.
my suggestion would be to turn on your video because
Yeah.
presentation is not there. It's great to see you.
Yeah, yeah. Now if it's gone, the background noise is gone, we can have him back on.
I want to turn on my video.
Yeah, yeah, sure, sure.
Is this better?
Yes. Okay.
Sorry, I just came outside.
Yeah. All right.
So yeah, sorry. Hello?
Yes,
There's
please.
no signal is not good enough. Okay, let me know if I'm not audible. I'll keep speaking and try to power through this. Should not happen. But in any case, so I am Dr. Varad Tamvekar. I did my MBBS from AIIMS New Delhi, and after my MBBS, I worked at Search Gadchiroli. I worked in Search Gadchiroli, which is on the border of Maharashtra and Chhattisgarh and Telangana. Hello. Hello.
Yes, you're audible.
Yes. Okay. Thank you. Yeah, and so I
background
worked there
noise
for
from Dr. Dinesh.
yeah. Yeah, this is much better. Can I speak now?
Yes, please.
Oh, thank you. Yeah, so I did my MBBS from AIMS New Delhi, and then for 1 year I worked at Society for Education Action and Research in Community Health in Gadchiroli. And so, and after my 1 year over there during COVID times, I am doing a master's in translational health in Oxford, and I want basically in public health, and I want to do a PhD in public health, and I'm interested in access to diagnostics in hard to reach places like all those centers that you see. So one of the observations I made when I was in search that diagnostics are very poor quality and they're just not there. For any simple tests, you have to send the patient so many kilometers or miles away, and then they don't have the money for that, and it's shit. And even if you do, like reports come back with query appendicitis, irrespective of whatever the disease is for ultrasound. Once for one patient had ruptured ectopic pregnancy and it came query appendicitis. So it's like the situation is not very good. Situation is pretty bad, and that like I feel it affects me a little bit, and so that's what I want to work on. And so all the stories that my the previous speakers have said, they're so relatable, and I think they give you an idea about what life is like in a primary health center in a village far removed from the city, close to nature, close to people, and in a situation where you're slightly alone, the mental health aspects of it, navigating a new random space all alone, all those challenges you'll face, and you'll definitely enjoy facing them. What I'll sort of tell one point is that how did I end up making that decision, or how did I decide on it? Uh, so during my MBBS, I did an internship at IIT Kharagpur, and I realized that there is so much more to medical to health than just being a doctor. There are upstream processes about how drugs are made. There are downstream processes that if you have a drug, how do you implement it? If you have a program, how do you implement it in the real world? And so it got me interested on the whole spectrum of health, from bench to bedside to populations, is what I call it. I try to get experience in as many things as possible to try to find what I really wanted to do. And during that process, I realized that the decisions that we make, in the sense that so many of my friends were doing PG without understanding what all options were open for them. It was sort of there is one straight line, and it's so easy to walk on it, and it's so comforting because you see everyone else going through the same, torturing themselves and uh, going through the same exact life, that there is comfort in it. And when you see other people going through what you're going through, you relate to them, and you're like, okay, you don't feel that bad. But when I wanted to do something completely different, everybody kept asking me that, why do you want to do this? Why do you want to do this? Or like, what will you do in a village? You won't have friends, and you're treating poor people. There's no point in doing that. But I had explored enough that I was sure in myself that this is what I wanted to do. This is the life which I wanted to see. And so uh, just navigating all of those negative comments and realizing that the decisions that I made were because of my own observations, not because what my parents or I don't know, the peer pressure or whatever else was dictating me to do, which made me sort of more sure about what I wanted to do. And so if you're thinking of making this decision about practicing in a rural, remote primary healthcare where there's so much need, there's no one else apart from you. And if you are making that decision by yourself, then it shows that you've thought about it and that this is what you really want to do, and you're not just going on a flow. And do you want me to? And even sort of, if that is not the decision you want to make, I would just say that the decision making process that you apply for it should be the one that you're comfortable with, that you've thought through what all options are there. I think all the options which previous speaker said, they elaborated a lot on those options. Another point, so you can speak to them about any of those options. in detail in any one of them. One more thing I would like to say is that the medical education in and of itself, the 5.5 years is incomplete. Like we were having this discussion that there are three components necessary in any education, which is theory, practical, and responsibility. And so medical curriculum does a very good job of providing you with good theory, a lot of and some practical here and there. But one thing it is very poor at giving you response. Medical curriculum in and of itself is sort of incomplete. And so if you want to really understand what being a doctor is like, then taking up responsibility and working in the primary healthcare setting where you are sort of, you're the most important, you're the leader over there as a doctor, which is, it just completes your entire educational experience. One thing I'll say about practicing in such a practicing in a PhD is that because you're a doctor, in the tertiary healthcare setting, you're the least in the food chain, the smallest in the food chain. Nobody cares what you do. You can do whatever you want. And the moment you go to a PhD, you're the top of the food chain. Even people who are older than you start respecting you or start expecting you to behave like a leader or start to respect the community of being a doctor. And so it gives you a sense of what this degree really means and what you signed up for. What future directions you end up taking, it's highly irrelevant in the sense that uh, I had this observation that I wanted to learn a bit more. That I wanted to learn how to manage diabetes properly. If I had a diabetes patient in a primary healthcare setting, I can't manage them properly. I had to go through the like MD training to understand how to properly manage a patient so that I could do justice to them. And which is observation that you might get a little. So I'm not. So the thing is that the door to an MD or a super specialization position does not close even if you sort of explore yourself. Sort of take some time to explore what is it you really want to do. At AIMS in my college is that everybody wants to work and stay in AIMS for the rest of their lives until they die, because it's so comfortable. Uh, it's trodden down, and you know that, and also it's pretty good. You get so many benefits. But uh, the moment I went to search, the aims was so far removed that I actually understood that what variables are necessary to become a good doctor. Like even so my college from where I did my post-graduation did not matter to me that much as the skills that I ended up gaining. So there are these interesting observations and learnings that you will have yourself. That what is it that I really want to learn? How do I really want to contribute? Do I want to be a scientist? Do I want to work in a tertiary hospital? So it's just a way to explore yourself. Another thing I'll say that doing an MD straight after your undergraduation or MBBS is a very Indian concept. It's not an international concept. Uh, I have been in Oxford in 1 month, and rarely have a PG or a PG straight out of their undergraduation. Most of them have either worked or traveled or done really cool things in their lives. Someone went to Senegal. Someone interviewed sexual abuse victims. Someone has worked in a private equity firm. Like whatever examples are there. Like people have always, like international people at least, I'll say, they always wanted to and explored. And the university, it's pretty good university. So the people over there are like, they have thought through all of this process, even though the decisions don't make sense in the moment, or even though the future is not very clear, the thought process behind it, that exploration is important to understand what really matters to you. That's, I think, the key learning that I have had by like my own journey and talking to so many other people. Yeah. And if you want me, I can give detailed experience about what all work that I did in search, but is that something that you would want to hear?
We could probably wait for questions then, if someone asks,
Yeah, fine.
right?
Yeah, sure. But like these are my like two. I'll just summarize my
Yeah, sure. Definitely.
I'll just summarize my 2 points. First one is that the decision you end up making, make sure that it is the decision that you want to make, not a decision that out of peer pressure or family pressure or any of those pressures. And to be able to make that decision, I would highly recommend to explore straight out of MBBS, because we don't know. We have been in this silo of a glass building, which has been very protected, and we've never had this close, visceral connection with the community or with the patients before. And so, and the second thing is that if you think you're alone in your college about thinking of exploring, just remember that in the world you are not. You are in the majority. Even like just because people next to you are doing stupid things doesn't mean that the entire world subscribes to that idea. And so don't be afraid, don't be scared, and go explore. I don't know. Always a very
Okay. We lost him totally. Okay, Varad, are you there?
me.
Yeah, we lost you.
Yes, I'm here.
Okay.
No, I'm here. I'm here.
Okay, so I'm assuming that was the last. Those were your last points. Okay.
Can you not see me?
Yeah, now.
Yeah, but I'm done. I'm done though.
Okay. Yeah. So thanks a
Those
lot.
are my last points.
Yeah, thanks a lot. I am reminded of telling people that um, I'm reminded to tell that MBBS doctors, we need to feel good about ourselves and feel confident. I think a lot of peer pressure is also from that we are not capable of anything. And I think these explorations and experiences in primary care would make one much, much better and much, much more confident than even an MD, triple MD, DM person. So one thing certainly is not to fear and not to feel underconfident, and not to compare oneself with anyone around us. And like Bharat said, we are not alone. If we look around, we are not alone. There are many people who take, I would say that should be the conventional path of having more primary care physicians. So I will thank all the speakers and open the floor for questions. Yeah. Okay. So please don't be afraid to ask questions. You can type in your questions or you can raise your hand. In Zoom, there is a provision to raise your hand, and we'll try to be as fair as possible. We have about, should we say 15 minutes?
What's the time now?
It's 7:07.
Yeah, maybe 30 minutes if people are okay.
All right.
Till 7:30.
Yeah, okay. All right. So people can start firing questions to the four speakers.
And also, as Vasundhara said, so there is no right or wrong questions here. So, and just wanted to recap the context of this presentation. Just because there are like a lot of MBBS doctors here who are working in rural setup, it's not that the purpose of this webinar is not to force everyone to go and work in rural setup. It is just that there are several alternate paths available after MBBS, and which path you take is purely dependent on your own personal calling. So in that sense, I think whether you work in rural or if any of the young MBBS doctors here are happy working in a city, a corporate hospital, that is perfectly fine. I mean, there's no judgment here in this safe space.
Hello. I'm Dr. Chaitanya Inge. So I'm working at I have a question. So I'm working at a very remote location in PHC Lahiri, that is in Gadchiroli. So I have been working here for past 5 months, and now I realize that I don't have mentors over here or somewhere from where I can learn things. So my exploration part was complete, but now I suddenly start feeling that I'm kind of saturating over here. And so now I plan to leave this place. So did anybody have such an experience?
Does Pradeepa want to go for this? Because I know something.
Yeah.
Yeah.
So yeah, even I have had those feelings because at sometimes, like I feel that I'm just doing the same thing again and again, and the things that I want to, like maybe I'm not skilled enough to do, manage the complicated things and all of that. So that does get to me. But I think what has helped me is that to go back and use resources like there are the CMC value distance education programs, and like we have apps like Up to Date, where you get details about cases, and the network of doctors who can like Vasu ma'am and the doctors in our organization. So to talk to them and to ask for resources and all of that, I think has helped me to narrow it down and feel like I'm useful more. So it does get to me. So I don't know, maybe that will help. I hope I've answered your question.
Yes, that was helpful.
Anyone else? Ramya, Divya, Varad, if you have faced.
So this is very common. If you don't feel it, I think then it is a problem. So I remember after 6 months, it was just the same thing for me again. And I remember we had a EC meeting. Then I raised out this thing that I am feeling saturated and my learning graph has just become straight, like flat. There is no more learning in that. That's when we had Dr. Anthony, Anand, and everybody who were very kind, and they wanted to help us in this. And that's when they started having more online teaching. We had classes from resource people. So if we want to learn something, there are a lot of people to help, and especially in the rural the health network, there are people waiting to help us when we feel that we are not learning anything. So that time they will point out places where we should learn, or like they will tell us that okay, this way you can improve, because I was feeling that my clinical is enough, I will go to administrative. Then when I was talking to people from CMC, they told, Ramya, you don't realize you're already doing the administrative work. So like when you're arranging for a camp, you're going to see how many people are coming there, or okay, we give eggs and chana, is it enough for everybody, or have all your patients come there? So all those things, we are going to actually make a report without making a formal report. We have it. So the saturation, I think once we feel that saturation, there are other domains in the same organization which we can involve ourselves in, and that won't make us feel so bad. But there are people here who will help us, and they are also in the talk. They might involve when we need help. That's it. Thank you.
Yes, I will also just say that same thing. Don't be afraid to call like anybody who is anybody. They will all help you. So I had a snake bite case once. I didn't know how to manage snake bite, so I just called the person who wrote the book on snake bite, and they will help you because they know that where you're working, it's not a very good place, or you have no help, and so people are very willing to help you if you make that decision.
we have only Divya left to, if she has any comments on this, feeling lost or not having a mentor in.
I actually there was definitely some lack in mentorship in last center which I visited as a travel fellow, but like it didn't really hinder my exploration because I was already used to being a travel fellow in the first organizations. The other thing that if you're getting saturated, like that was my criteria to leave a center actually. If I'm saturated, I just leave the center and jump on to the next one. I had the privilege of doing that. But otherwise, even if I think about Rajasthan, there's a lot of things that you can explore and do. You just have to find out, like, and if everyone's just very willing to help, you can. There are some fellowships also that you can be a part of. If you want to improve your learning, there are some distance learning programs for CMC. There's a program with AFPI. So that's there. Everyone's actually very willing to help because all there's an MFC circle. I think you can also contact people because all of them are doctors.
Okay.
Like, can you share the links to these resources?
Sure, Vasu might have more of those, I think. But yeah.
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 Arvind has been sharing some links on the chat, so please do go through that, and maybe he can repeat all those once again.
There is a question about CMC distance education course. So Dr.
Also wanted to just throw in this open-ended question that the lack of mentorship is not necessarily, there is no short one gets mentorship in by doing PG. So even one will need a mentor throughout the life, whether we are health professionals or not. The only thing is we shouldn't be afraid to pick up the phone or send an email or go meet someone. It really helps to talk out our feelings, and there are many people out there who are willing to help. Okay, so any other question from the participants related to why they chose the... And I have wantedly put in 3 girls here because I think we do have a disadvantage compared to boys, and that doesn't end after a certain age, I should say. So yeah, so if anyone has a question about that or anyone wants to comment from the speakers. We might lose Varad because his battery is running
No,
out.
I got a charger. I got a charger. I got a power bank.
So any more questions?
Also, I was saying that Dr. Anand Zakaria would like to
Oh, sure. Yeah.
So I'm Anand Zakaria from CMC Vellore. So I teach here in general medicine. So the question was about the distance education courses from CMC. Can you hear me, Arvind and Abhirami? So there are several distance education courses, and this department was set up by a pediatric surgeon by name Vinod Shah to address the disparities in healthcare. So he said that in rural areas there are many doctors, but they're not trained in primary care. So in around 2004, he set up the postgraduate diploma in family medicine, and this it's called PGDFM. There are 2 versions of this. One is for primary care providers in the government and in the private sector. There is also one for the post-MBBS, those who've just finished MBBS in the last 3 years. So that course, one for the post-MBBS, I have been involved in. Both the PGDFM versions have around symptoms. So the PDDFM is constructed around 100 common symptoms you see in primary care and teaches you how to manage in a resource limited setting. So it's got modules. Earlier it was in print form, now they are online. There are contact courses where you learn various skills, including deliveries, basic suturing, spinals, lots and lots of different skills, how to apply a POP, and it's got support. So it's really one excellent course, useful for anybody who wants to do primary care. And for those who are working, spending a year or two working elsewhere, this is a very good course. So I'd encourage you. There are other distance education courses also. There is one on diabetes mellitus. There's on psychiatric care in the community. There's also a general infectious disease course. You can go to the CMC website, and I think the link has already been shared in the chat box. There are still openings for travel fellowship in primary care for this year. So anybody who wants to apply can go to the THI website, and I think Divya has already shared to you about the travel fellowship.
Is the content available for download? The resources which you mentioned for those who are not in the course?
No, it's a formal course, Chaitanya. So the course is not available freely online. But if there are specific things that you need help with, I mean, that can be addressed.
Dr. Anthony wanted to ask a question or comment.
No. Good evening. I'm Anthony, and I'm speaking from Cochin. All that I wanted to say is that in times of an emergency and how to manage, gone are the days in 1979. I carried newly purchased some current diagnosis and treatment of medicine, pediatrics, surgery, and obstetrics and gynecology. So it was four fat books was a reference. That is, I didn't take any textbook. And those days there was no mobile, and it was all learning by experience. And even how to get a breech out is the senior staff nurse midwife teaches you how to apply a forceps, everything. But things have changed, and I've seen this app up to date is so helpful. I mean, I've seen it in JSS, Ganyari, people, all juniors and seniors, everybody using it, quickly referring, and it's fantastic. If they don't know, they will say that they don't know, and they look up, and that is urge to give the best quality care to the periphery, people in the periphery. Rural healthcare doesn't mean secondary healthcare, or primary healthcare doesn't mean half of or 1/3 of the tertiary care you give. No, it is the best of what you can give. So that is a thing, and there is always this contact programs are there. And with the iPhones now in your hand, you are not cut off at all. So that's the confidence. The only thing is, and at the same time, you have got the opportunity of leadership and show your daring skill there to how to manage that patient. So that's fantastic opportunities. And as you say, if you feel that you're burnt out, change the scenario, and you'll get to regain your strength and motivation and energy. And a fantastic presentation by all three girls and the young lad Varad from Oxford. And what he said is that nobody comes as a PG student soon after MBBS internship. That is only an Indian notion. And okay, an Indian notion is as soon as you finish internship and house agency, you have to get a girl and you have to get married, and the father-in-law buys your PGC. Those things have to change. Thank you.
There is a question in the chat box saying, asking if one has to do a DNB family medicine to update the knowledge in primary care, or do we have to work in primary care first? I think it is more like keeping your eyes and ears open. Whether you get a degree, it's like a stamp, but it's how you actually take in that knowledge while you're doing DNB, or even when you're doing nothing after MBBS. So one might be a better physician than a person with a DNB degree. It is how you take in what you get and how you make the most of it wherever you are. So yeah, it's a more philosophical answer, but if you're looking at employment, marketability, that's when these things count. But if you are good in your skills, one will be recognized even if you're just plain MBBS. I remember Pradeepa saying that we may not be making a change or we can't change the situation, but actually just talking about your experiences to more and more people, and yeah, telling more people about what you have seen and what experiences are there, that itself is a step towards change. So yeah, again, doesn't really matter how many degrees one collects. It is how you collect what you get. Any more questions?
Hello, hi, this is Royson. Hi, have a question to Ramya. Very good presentation. You said one of the reasons you chose to work was your experience in MBBS, that your medical college provided a fantastic community program. I'd just be interested to know to what extent was that? And also, apart from you and your friend Samiksha, were there any more that chose this path that you guys have chosen? Thank you.
So I will tell you. So my college, Dr. Anurag and Dr. Madhavi, they were working in our college. They joined newly when we came, and they had nutrition and tuberculosis project, the CNS project, Center for Nutrition, and in that we were involved. And then we had a lot of we had cancer awareness programs, which the NSS of Enapoya has taken up, and it is they had in all the states. We used to go to different states for the cancer awareness, and then we had camps. Like we have regular camps every month. There is camp in different districts, so that in Karnataka, so we could go and work there. And also our community medicine postings only involved us being in a rural setup. So I was in one PHC, which was run by a doctor for almost 16 years. He is now. And it was, for me, it was very like that was the place I really got exposed to this clinical, the rural health especially, because I used to travel on my scooty 10 kilometers to reach that place, and then I would be the only doctor. And then if it rains, patients are less. If the weather is very good, patients are more. And then it is more like there I realized that if I come back to hospital, they will ask, oh, MD medicine, MS surgery, or gynecology. There is they want what do you say, a specialization. But there I realized that people don't care about the specialization. They just want some doctor to see. And as I think even one of them told that we are, even the eldest person will think that we are higher in the hierarchy. So there, really, I got to experience a lot, and I would say that that one place, putting us in rural postings during our community postings itself, made us sensitized to this rural health. And if otherwise, other than Samiksha and me, no, not everybody want to do this, because I now also I share the work sometimes. I get a lot of messages, Ramya, the work you're doing is very good, or you and Samiksha are doing a good work. I will tell, okay, then come here. We have scarcity of doctors. Please come here, work with us. But then again, people don't want to come here because main reason is PG. So everybody is in the rat race for the PG and they want to go there. But otherwise, the interest, everybody has the interest for rural health. And again, when I was in this place, Swasti Swaraj, I got to visit Jan Chetan Manch, and then JSS Bilaspur and CHB Bisham Katak. So when I went there, I could realize that there are more people of my age group who have left the mainstream and come to this place to work. So that's it. I would like to tell that very less people take this place. Anything else?
Anyone else? So again, as Arvind has said, that it's not just rural health we are pushing for here. We are just telling that there are many options other than, the next being NEET PG. One could end up doing NEET PG, but not necessarily immediately. And there is, and one can totally remain confused. It's okay to be confused. And one will remain confused even at age, could remain confused even at age 75. So PG doesn't answer all the...
Vasu ma'am is always confused.
And I would say confusion, it fosters creativity and it pushes one to think beyond, one's limits. So it's good for the brain. So, any more questions?
Yes.
Okay, we have one. I don't know who that is. It will be nice if someone can, if that person can say, what to decide if we are not sure about career in a path we are thinking of going, like financial stability. For example, I want to opt for MBA after MBBS, but I'm not sure about the far future on this path. Does anyone want to comment on this? Can we hear Divya?
I can take this, yeah.
Yeah, right.
So, it's also a matter of privilege, I think, that you're thinking about taking an optional path, because sometimes it's very difficult for people to get out of the straight line that everyone has drawn for you, MBBS and then PG, and the stability that comes with it. But if you're thinking about it, I think it's best that you explore different things. Travel fellowship is one way, and there's openings still there, because or you can like try to work as an intern with some firms or something. I don't know, like you figure out what you're interested in and try to just explore, get into it, figure out if you like it or not, and then you make a decision at what you want to do. I mean, you always be confused. It's like there's no way, but at least you'll have the confidence, this, I can make it. Like, I'm a doctor. Because it's a privilege. Whoever tells that you're just an MBBS doctor, you're not a PG, you can't do this and that, it's this false. Like, you go and sit with the people in the villages. They treat you like it's just amazing. So try and explore, try to figure out. I mean, for MBA, I have no idea about the contacts. Vasu will definitely have them. I mean, she can get you in touch with some people who are doing it, or something else. But I think exploration is the initial path.
So Divya, the question is more about also about the financial instability or insecurity and that fear whether they will make it or not. So anyone wants to? I have an answer, but I'm not going to say it. I would like the speakers to say something about the
Financial
fear.
stability regarding the new path that the person's taking,
Yeah.
right?
Yeah, and the future.
I mean, you make enough MBA he's talking about.
Not necessarily MBA, it could be any path, but where is the surety? What's the surety?
There's no surety, I think. But even as a doctor, like, you can always earn enough to like sustain yourself and obviously your family, because it's actually like like I said, MBA is a privilege. There's always going to be a need. You can go and work in a PHC or working with an NGO because they're always looking for doctors.
I want to come in here.
Okay.
As a doctor, you will never ever starve in India. If you are a conscientious doctor, patients will come to you. You don't need publicity because satisfied client will be your advocates and they will give more and more patients. Whether you have got some sound knowledge and don't make stupid mistakes without learning the basics, you are safe. You will get enough. Now, MBBS, MBA after MBBS, you are carved out to a higher echelon of corporate hospitals or even the so-called mission hospitals. You climb up the ladder as administrators. You manage things and you become a manager. But if you want to be a basic clinician, you don't need all that. You need more knowledge and skills, and that with or without post-graduation we can acquire it, and you'll never ever starve. Be ethical in your practice. Your patients will bring enough and more money for your needs, but not for your greed. Thank you.
I'm just.
Can I just say something about?
Sure, Varad. Go ahead.
So there's a different way of looking at money, in the sense that what type of game you want to play. Is it like a zero-sum game where you're just working for the salary which is coming on the 31st or the 1st of the due month? If you think that the private sector is very lucrative, I would suggest you otherwise. There are many stories with people who have set up their hospitals on debt and are just working to clear that debt, and so I wouldn't call them wealthy in any case. Also, if you look at the competition in metro cities, until and unless you are DNB surgery, like no good hospital will even take you. So you'll even if you do a lot of PG, you'll have to move to a tier 3 or tier 4 city to build a monopoly and get what you call real wealth, unless you have generational wealth, in the sense your parents have own a hospital and stuff like that. The thing about MBA is that it's slightly different than MBBS, and so the hierarchy over there becomes a little tricky. I'll say that because if in a corporate hospital, I have realized a little bit that even though like MBAs pressure doctors to get the test done, see more patients, but in the end, if you look at the hierarchy, the general surgeon will definitely outrank an MBA. So it does not mean that MBA is bad. Definitely does not mean that. I'm just saying that there are these multiple perspectives that you should need to look. The only way to find out what works is to do it yourself. Until and unless you do it, if you believe in other people's words, you will end up living other people's lives. Try to see the world through your eyes and just experience, explore. I think that's the way to make good decision, or be at least satisfied with the decision that you make. Right? I don't know. Okay, that's my money philosophy. Thank you.
Thanks. Maybe one more question and then we will end it. Gone beyond time. Also, adding to the money thing, I tell people that if you want quick money, then medicine is not the profession, and you should go for, unless you want that stamp of a doctor and then make money. Yeah, otherwise we'll never be hungry. We have a wide range of choices with our degree. We can choose not to be medical professionals and still make money, and we have this whole range up to being a doctor. But if you want quick money, then I think stocks and shares or real estate are the way to go. And this is not the profession. If we look at it that way, we are privileged to, and we have this responsibility of keeping the community and people over the money part. And it's never going to, it's always going to be enough. It's all in the mind, what is enough.